The People's Platform.
Good evening and welcome to the show. Unveiling the 2024 budget earlier today, President Ranil Wickremesinghe, in his capacity as Finance Minister, pledged his commitment to identify shortcomings encountered in the journey thus far and to rectify them. How will Budget 2024 impact the growing crises in the health sector? How do we go about averting this growing crisis in health? Let's find out by talking to Dr. Vinya Ariyaratne, President of the Sri Lanka Medical Association. Good evening and welcome, Dr. Vinya.
Good evening, Sonali.
Good to have you here with us.
Same here to be here.
Dr. Vinya, let's first talk about Budget 2024. It's a bit too early to analyze all the figures, all the implications on the health sector. Some of what was told this morning was that guidelines will be issued and a separate institution will be established for the medicine procurement process. And that medical research will be upgraded to international standards by strengthening laboratory services. I'd like your feedback on this issue of a separate institution being established for the medicine procurement process, because currently there is a methodology that has been stipulated with checks and balances. So talk to us about this new concept, if you can help us decipher.
Yes, thank you, Sonali. I think I haven't still read the exact wordings how the budget proposal is formulated, but I think first I'll comment on the identification of shortcomings in the health sector and the President's commitment to address. I think that we welcome. The shortcomings are already identified. The solutions are also there. So I hope that this commitment is to really implement the solutions that have been already proposed by all professional organizations, including the Sri Lanka Medical Association. Now coming to this recommendation or the budget proposal to have a separate agency for procurement. Now again, I'm not sure of the details of it, but as you said, the National Medicines Regulatory Authority and also the normal procurement guidelines are there. But we all know the past 2.5 years, all these guidelines have not been followed, and there had been serious violations and exceptions given, exemptions such as the waivering of registration and so on. And if those regulations have been adhered to, I don't think there is a need for a separate procurement agency only for the health sector or the for drug procurement or medical supplies. Now what has happened is that the procedure or that entire cycle of identifying the quantities or the kinds of medicines that are required and the quantities and also placing orders, all these things have been undermined. That whole procurement standards, practices have not been followed. Therefore, we ended up in a situation where poor quality drugs and also shortages of medicines have really plagued the entire health sector, and we have seen the preventable deaths as well as so many complications to the patients. So I think the commitment to correct the procurement, the deficiencies in the procurement process is, I think, commendable, but in principle I don't think we can agree. We can't understand the rationale, and we have serious concerns if such a separate agency is to be set up, because it will take time also, and now we are in an emergency situation where we really need to rectify this situation and have quality, affordable medicines in the system. So by having a separate agency, I don't think we can address that issue.
Okay. Over the past few weeks, we've seen shifts being made to those at the helm of the Ministry of Health as well as the National Medicine Regulatory Authority, the NMRA. How will these shifts result in the country being able to chart its course towards averting this growing crisis in health?
Yeah, Sonali, I think it's important to recognize that this crisis, the origin of this crisis or the root cause of this crisis is related to governance. Of course, the larger governance issues are there, but in the health sector, we know there has been serious concerns with regard to the way the health sector was managed, both at a kind of a political level and also at an administrative level, and particularly in relation to drug procurement and the entire functioning operations of the National Medicines Regulatory Authority. So one can say that okay, just changing heads will not change the system, but I think we have had a very robust system, very reliable system, and people had trust in that system. They knew that if you go to a government hospital, the medicine that they were getting was not of poor quality. They knew that it was quality medicine, and even the doctors didn't have any hesitation in prescribing medicines in that system. So that trust was breached. So when you lose confidence, it's very difficult to restore. So by having changes at the top, it also gives a very strong message that the government wants this to be now, there has to be a remedy, and then that's the first sort of important response. So we have to give time, and we have full confidence in the leadership of the NMRA, and of course the minister has already sort of pledged certain things, and I hope the minister will follow what he had already pledged. And I think the people also have to hold the system accountable to deliver. I mean, that has also been lagging. I think we have to make all the government institutions and also these other agencies such as NMRA really accountable and following these procedures. So we have confidence that the new leadership in the NMRA will adhere to those guidelines, because they have also been part of our own SLMA efforts during the last 2.5 years. So we are confident that that things will change, and also we welcome those changes.
If we are to talk about health governance, which you briefly spoke about, the recently released IMF governance diagnostic report, as well as the governance diagnostic report released by civil society, including TISL, both allude to the urgent need to address issues in the health sector. How must this be done in a streamlined, cohesive manner?
So one of the general recommendations is to make the procurement processes very transparent, and also the disclosures, right? By now, if you look at India, they have a dashboard where public can access and see for which kind of supplies government requirements have been open for bids, who have bidded, their previous sort of credentials and all that, and also including the companies that have been blacklisted.
Okay.
Now, have you ever heard of companies in any sort of government supply mechanisms who have been blacklisted? So this is the problem. So I think what is required is that even the IMF report requires that to have a transparent system, and within it's a time bound. I think the government has to establish that, and that will avoid without having paper kind of proposals based on paper, and have submissions through a information communication technology system. IT system. I think that will help a lot. So here I think governance means, at least for procurement, of course it goes beyond procurement, also adhering to other principles of accountability. And also, for example, we have audit reports, the Auditor General reports. There are annual service reports. There are deficiencies identified in all those. So there has to be mechanisms to address those deficiencies. Now, even in the crisis that we are facing now in the pharmaceutical supplies and other supplies in the health sector, these deficiencies have been identified repeatedly by the Auditor General every year.
Yeah.
Sadly, that those have not been addressed. So I think rectifying these deficiencies in the procurement system, and then having all the technical evaluations done very objectively, not influenced by outsiders, I think that's critical.
Sure. And you spoke of the importance of proactive disclosures. The right to information is constitutionally enshrined, so we can also use perhaps technology to very simply make this information available to the public.
Absolutely, and even if you look at the drug information systems that are there, right. Now in NMRA, I think that, you know, it's a very well known story. There had been a system which was introduced spending millions of public money, but it was dysfunctional. Now we have, of course, the other medical supplies division has a system, and you can online see which drugs are not available at the moment, but the reliability and also how updated this information is a bit doubtful, because now the IT systems are there. Even in a remote hospital, if the pharmacy is lacking a particular medicine, then it will be notified, and there is a system to place the orders, because sometimes it takes more than 6 months for a particular drug to be manufactured and delivered to hospitals. So I think we really need to automate our system so that there is no personal physical contact in procurement dealings.
That will reduce the corruption drastically.
Absolutely. Yeah.
Let's also speak about the role of the public in holding the government, the state, to account. Why must people get involved in this process?
Right. So, Sonali, now if you referred to earlier the some hospitals being closed down, some units. Now,
yes.
If you look at some of the statistics that have been published by the Government Medical Officers Association, there are hospitals, smaller hospitals, which have already been closed down. Actually, this was a development that happened very recently. They are primary medical care institutions. That means that is the first point of contact for most people. So we have a tendency, of course, because they don't have all the facilities, and people bypass these primary care institutions and go to what we call the tertiary care hospitals, the district general hospitals and so on, or come all the way to Colombo, but now people can't afford that because their transport cost has increased and so on. So now there are about more than 10-12 hospitals, primary care units, which have been closed down, which is very unfortunate and never happened in the history of the country. Even during the time of the war, even in North and East, most of these medical institutions were functioning. Then if you look at some of the specialist units in major hospitals, they are also being closed down. It could be the cardiac unit, or because there are no anesthetists, and so it's a serious situation. So when you look at the total functioning of the system, public has a role to play. Now this take for example Polonnaruwa. Now Polonnaruwa primary medical care unit, Kakuluwela and Kandakadu, both have been closed down. Now the people in that area should hold the member of parliament from that area accountable, no? So because he has to raise those issues in the parliament, or in whatever the way. So that is how the public should also raise their voice, and then also right to information. They can ask, why this hospital is now closed down, how can, and also it's not just asking, putting the full responsibility on the government. There are also others who are helping now. Most hospitals are being helped by philanthropists and local businesses, even donating medicines that they can't get through the central procurement mechanism, just to save lives.
Yeah.
Cancer drugs are not there. There are many essential drugs that are not available. So we can find solutions, but the public involvement has to be there in an organized way. So that is why, while public take the responsibility to also be taking a lot of precautions on your own health, health promotion and prevention and all that, because you can't rely totally on the health curative healthcare system.
Sure.
So that way public has a responsibility, but ensuring accountability, definitely public has a role to play.
All right. We are in conversation with Dr. Vinya Ariyaratne. We're going for a short commercial break. We'll be right back.
The People's Platform. ICC Men's Cricket World Cup India 2023. Match between Australia versus New Zealand. Tomorrow at 1 p.m. onwards. Repeat telecast on TV1.
2024 budget will design the future of the nation, says the President. Public sector employees to receive an additional 10,000 rupees from January. Pension payments and senior citizens' allowances to be increased. Borrowing limit to be increased by 3,450 billion rupees. It would be a challenge to discuss with the IMF and creditors any proposal to reduce the personal income tax, which is being paid by 20% of the population, says an annexure in the budget. Burden on the masses will not reduce. Dr. Harsha responds to Budget 2024.
දැවන්ත බර අඩු වෙන්නේ නැහැ. දැන් මෙතන පුද්ගලිකාංශයේ වැඩි හරියක් මෙතන ඉන්නේ 90%. හරි එතකොට ඒ කට්ටියට 10000ක් හරි වැඩි කර ගන්න පුළුවන් වෙයි. එතකොට අනිත් දේ තමයි විශාල විෂයට ණය ගැනීමේ සීමාව වැඩි කරා. ඉතින් මේ ණය කොහෙන්ද ගන්නෙ? හරි පොලි අනුපාත වලට මොනව වෙයිද? නෑ ඒක තමයි මම කියන්නේ ඉතාමත්ම අමාරු තැනකින් තමයි ජනාධිපතිවරයා මේ
Chairman of the Central Environment Authority, who was remanded on charges of bribery, granted bail. Sports Minister Roshan Ranasinghe lodges a complaint at the CID. Legendary Sri Lankan cricketer Aravinda De Silva inducted to the ICC Hall of Fame. David Cameron returns to UK government as Foreign Secretary.
Good morning, Matya.
Kaya tapos ba ako daan?
Ano?
Komodo.
Yan may mag-isirahin.
Mambuat hari ini. Mati anda dipang, tukar mambuat hari ini.
Then වැඩ?
අපට සිද්ධ වෙනවා මිස්ටර් ආදිත්‍ය අරස්
නීල පබලු අද රාත්‍රී 9ට සිරස ටෙලිතිරයෙන්. The People's Platform.
Welcome back. You're watching the People's Platform. We are in conversation with Dr. Vinya Ariyaratne, President of the Sri Lanka Medical Association. Dr. Vinya, in Sri Lanka, we speak of a free health system. However, the health system that we have isn't very patient-centric or patient-centered. And at times, we see the manner in which patients aren't really cognizant of healthcare as a right, as an entitlement. It's often looked at as a privilege. This attitude needs to be shifted. Speak to us about how problematic it is to be unaware of one's right to health, and how we can go about shifting this mindset.
Yeah, Sonali, I think it's a very, very pertinent and a very important question. Now, when you say free healthcare system or free education for that matter, it is free at the point of delivery, but somebody has to pay for that, no? I mean, ultimately it's the public who we all pay for that, right? So then one issue is, how are we going to continue to finance that kind of system? And very few countries in the world have that kind of free healthcare system. So it has evolved over the years, and it has really produced results, and outstanding results. The health outcomes of the Sri Lanka medical care system is very well recognized. I mean, compared to the countries which have a similar per capita income, we are far ahead, right? But the thing is, because of this crisis and also bad governance and so many other factors, now this free healthcare system, but also this model healthcare system is under serious threat, right? So now the the question you asked about the patients or people feeling that this is a right, but it's something that they have to, when they receive a service, it can be of any standard and they have to just passively receive it because it's free. I think this has to change, and I am a strong proponent of having a charter for patients' rights and also responsibilities, and we have been, particularly SLMA, for more than 30 years have been advocating for patients' rights, and we hope that soon we will have a patients' charter which outlines the rights of patients and responsibilities as well. But it's going to be very challenging because there are many dimensions, including legal implications for doctors and all those things. So it's a complex thing, but I think it's very important to ensure that higher standards are maintained and also ethical standards. Now earlier there have been, our system was governed by ideals, all professions were governed by high ideals, and we adhere to professional ethics, whether it is in medical practice or legal practice or in media. Unfortunately we have seen a terrible deterioration of those values. So earlier you need not bring in special legislations to safeguard the rights of patients or anything like that. We as doctors take the Hippocratic oath, and it says, do no harm first. Even if you don't do anything, don't do a harm first. Then you do the something that's in the best interest of the patient. Then we have to safeguard the privacy, the confidentiality of information that the patient shares. So those are values that we cherish, and it is within that ethical framework that we practice. Due to so many external factors, including private practice coming in and the economic constraints faced by everyone, including the doctors, we have forgotten those values and ethics. So I think it's important that in a situation like that, to remind that there is a responsibility on the part of medical providers, healthcare service providers, as well as the recipients, to adhere to these principles, and that can be in the form of a charter. So right to health, although it's not explicitly guaranteed in our constitution, I personally think it should be, but there are many counter arguments to that as well. But I think it has been accepted that every individual has a right to access the best of medical care that the country can afford. So that's what which is now called universal health care, UHC, which is also in the one of the 17 goals of the sustainable development goals. And so we are looking at what you call equity. There has to be justice. It's not that we can provide the quality of care that you find in a Western country. No, everyone has the basic services can be affordable and accessible by every citizen of this country. So I think that kind of a system existed in Sri Lanka, and unfortunately we have deliberately undermined that system because of bad governance. So it's the responsibility of the public as well as the people who run the healthcare system, including the doctors, to somehow restore that confidence. And on the part of the patients also, on the part of the public, there's a very important role to play, because it's also their own health, and not to abuse the system, not to waste the treatments and medicines that are given to you. So there's a lot that we need to work on health, what you call health literacy as well.
Sure.
So although we are conscious about our health, sometimes we are really not literate about certain things that affect your health, and how we can reduce the burden on the healthcare system. Now if I give another example, the number one cause of admissions to our hospitals is what? It's injuries and accidents and injuries, result. So which is avoidable, and our hospitals take care of the patients very well, even after being admitted after a car accident or injury. The deaths are not the first 5, but the admissions cost a lot, and that's a drain in the healthcare system. Drunk driving, all these things, these are preventable things. So I think that the public also has a very important role to play here.
The worst impacted by the healthcare crisis are the vulnerable communities, and this has a direct interlinkage with food insecurity, malnourishment. How do you see this vicious cycle?
Yes, so when you are undernourished, then you are more vulnerable to infections, right? So it's a vicious cycle where your immune system is weak, then you are subjected to infectious diseases and other forms of illnesses, right? So that's why we can't afford to have our children, and particularly pregnant mothers, lactating mothers, not having adequate nutrition. So last 2.5 years, I think we have seen a decline in the nutrition levels to the worst of our children, particularly children under 5, even school going children. Not only school going children, we have reports and we are also helping sometimes through the civil society organizations, the university students, I mean those who come from faraway places, so they don't get a square meal. And we know that recent studies have indicated that more than 6 million people are food insecure in Sri Lanka. During the last 3 months we could see that. And also we have seen more than 50% of the population are what you call multidimensionally vulnerable, poor, poverty. So these are very alarming indicators, and then some of the impacts of this deprivation is going to reflect in our indicators maybe 2 or 3 years down the line, and it can also transmit to another generation. Say if a young girl doesn't get the adequate nutrition, her own growth is affected. When she becomes a mother, she will not be able to deliver a healthy baby, and that transmits to, that's what we call the intergenerational transmission of undernutrition. So I think it's a very alarming situation. So we have to look at food security, and for the food security to improve, the economy has to improve. So economy has to always look at the vulnerable population. That's why we need to have a social protection system. Even the IMF report emphasizes on having a robust social protection system. So until the economy improves and those people who are in poverty, they need to come up, and they need to also secure a sustainable economic well-being at some point, but they should be supported. So that's why there is a massive effort even from the civil society, professional colleges, to look after these vulnerable groups.
My final question, Dr. Vinya, what is the role of the Sri Lanka Medical Association in working alongside other stakeholders, including and not limited to the government, to ensure that Sri Lanka is able to avert this health crisis?
Yes, so Sri Lanka Medical Association is a apex body of all doctors in Sri Lanka, those who are working in the government sector, the private sector, academia, non-government sector. So it's a representative body, and we are a professional medical organization where we could quickly pass on new knowledge updates to doctors. So for the last 2 years or even beyond, we have been updating the knowledge of doctors and also introducing protocols to function in a resource constrained environment. So that is an important role that we played, and even if there are no shortages of medicines, how to manage with the existing supplies of medicines without of course compromising the standard of care. That has happened because we know sometimes there is over prescription, and even the patients would like more tests to be carried out on them, and so we have educated our membership, and they have significantly contributed. Then the professional colleges, there are now Sri Lanka Medical Association, it's an apex body. There are other professional colleges which are specialized in different fields. So they have been also mobilizing resources, philanthropic donations, drug donations, and then really going out of their way, and even to cover up for, say, like certain hospitals don't have specialists. So the specialists from a neighboring district will go there and then somehow attend to patient. That's the sacrifice that the specialist doctors and the members of Sri Lanka Medical Association and other associations really made. So I think they have contributed significantly, and we are committed, and we have also analyzed certain issues in the health sector. That's why I said at the outset that we have identified what are the shortcomings and the solutions are there. So it's up to the leaders to implement, the administrators to implement those and create the space, because we have enough and more honest and competent administrators. They should be able to operate independently and be able to address those issues, and I think collectively we can, if we really make an effort, we can make a change.
Okay, fantastic. Thank you very much, Dr. Vinya Ariyaratne. Thank you for watching us. We'll see you again tomorrow. Good night.